Good morning, April. My name is Carlos. I work in an emergency department. I have gotten the chance to take care of a patient with endocarditis. It was about a year ago, so cut me some slack. Um, from what I remember, this patient was in her mid to late 20s, female patient, young, uh, really no history, no medical history or family history. Everybody really was pretty healthy in the family. She came in complaining of some shortness of breath, chest pain, like you said, flu-like symptoms, malaise for a few days now. Upon bringing her back and getting some vital signs on her, she was extremely hypotensive, bradycardic, and she was running a temperature, but it wasn't anything too crazy. 102, probably something around there. Um, we actually went ahead and put a central line in her, which made antibiotic administration a lot easier. Um, we went ahead and tried to fluid bolus her first. Maybe, hopefully, that blood pressure would come up. We actually ended up putting her on vasopressors. Um, uh, the tests ran at the facility were obviously blood work. We did get some blood cultures on her. In my facility, it takes a few days for those blood cultures result to come back. So um, we weren't able to tell if it was bacteria right then. We went ahead and got some EKGs, got a CT scan. The doctor did an ultrasound of her heart at bedside to see if he could see any abnormalities just right there in the naked eye, visible to the naked eye. Um, we actually ended up shipping her out to Vanderbilt. Um, what I thought it was kind of weird about this patient was, like I said, she had no kind of medical history. She didn't have any kind of IV drug use or any recent dental procedures or invasive procedures done. No history of heart valve problems, nothing like that. Um, if I remember right, the provider taking care of her actually suspected viral endocarditis instead of bacterial. I'm not sure the reason why the provider thought it was viral. That's something that you're going to have to educate me on. Um, but yeah, this patient left in pretty critical condition from us. Unfortunately, I'm not able to deal with patients with endocarditis, for the period of time that you deal with them. You kind of able to see the whole process. Um, I thought it was a good idea to keep getting blood cultures on them until the blood cultures come negative. Uh, that makes sense to me. But I was gonna see if maybe you could help me out determining bacterial versus viral. Um, and yeah, thank you for posting your video.